Good day, everyone. We are students from BN3A Group 2B, and we are going to present our research paper entitled Nursing Students' Gender Preferences for Nursing Care by Tara Angela Diva, Alejandro Emil Dizon, Ray Andorone, Daniela Estanda, and John Anthony Gabushon. Gender discrimination in nursing is the rejection or restriction done on the sole basis of socially constructed gender roles our society had made, which would prevent a person from receiving full human rights. Gender bias in healthcare can manifest as the assumption that female nurses are better in giving quality healthcare than male nurses. Nursing continues to be viewed as a female-dominant industry, especially by male students.
The study aims to determine the student's gender preference for nursing care to better understand and be sensitive to various preferences associated with male and female nurses. First is to determine the profile of the participants according to sex, age, and section. Second, what is the student's gender preference for nursing care procedures according to... Lastly, we want to know if there is a significant relationship between gender preference and the profile variables age, sex, and section.
Significance of the study may benefit the following. For the hospital administrators, this may allow them to improve the service quality by having the knowledge and understanding on the topic. For the clinical instructors, this may enable them to find ways and measures to improve the quality of learning in the educational and clinical setting despite the situation. For the registered nurses, this may allow registered nurses to promote diversity in the workplace and create an opportunity for nurses to practice their profession without restrictions. For the nursing students, the students' preferences can change over time and develop professionalism and evolve to become competent nurses in the healthcare setting. For the students, the findings of this research may allow them to be aware and have a better understanding of the context that arise in the healthcare setting brought about by gender preferences. And lastly, for the future researchers, the ideas and results presented may be used as reference data in conducting new researches or in testing the validity of the other related findings.
For theoretical framework, this study is anchored on two theories, namely Janice Bohan's theory regarding gender as a social construction that emphasizes that gender is continuously changing and focuses on what people do, not on who they are, based on the nature of the situation and the perspectives of those involved in the interaction. And lastly, the socio-cultural perspective theory by Catherine A. Sanderson.
Conceptual framework, the schematic diagram presents the two aforementioned theories in the top box. The researchers believe that both theories' concepts combined contribute to one's gender preferences for nursing care. It is connected to the box below it, consisting of the study's participants' demographic profile, because the researchers want to prove whether or not there is a significant relationship between the demographic profile variables sex, age, and section with their gender preferences for nursing care. Following, a double-headed arrow connects the said box to the title of the research, which is Nursing Students' Gender Preferences for Nursing Care. This is to signify the continuous back and forth flow between both the participants' variables and their gender preferences for nursing care.
Hypothesis statement: there is no significant difference as to gender preference when taken as a whole and grouped according to sex, age, and section. Methods.
For the research design, this study utilized a quantitative descriptive research with the use of a researcher-made online questionnaire. The goal of this instrument is to determine the profile of the third-year nursing students, as mentioned, as well as to determine their gender preference towards the different nursing care procedures indicated in the online questionnaire.
For the participants of the study, the participants are third-year student nurses of University of St. LaSalle and was determined through stratified random sampling. From 179 total population, it was narrowed down to 123 as a sample size.
Research instrument, the researchers utilized the 4-point Likert scale. Validity of the research instruments, the research used the Gooden-Gates validation tool, Cronbach's Alpha SPSS statistical software for reliability, and the chi-square statistic for the analyzed gathered data from the Likert type items. The obtained validity score is 3.9 to 4.0, which is very good, and the obtained reliability index is 0.9021, which is a high reliability.
For the data gathering procedure, first, the online questionnaire was developed by the researchers, then the online questionnaire was validated, and then the participants answered the online questionnaire, and then lastly, all data were collected and kept confidential with the researchers.
The statistical treatment, computer processing was used in statistical treatment through SPSS computer program.
For the ethical considerations, approval from both Nursing College and Ethics Committee or GAC was sent. A letter was then given stating the nature and purpose of the study and an option to include or exclude their names in the questionnaire is present, and assurance of strict confidentiality was observed. Here are our results and discussion. This section presents the data analysis and interpretation of the survey conducted. Table 2 shows that 65.9% are female while only 34.1% of our respondents are male, and 85.4% are aged 20 to 21 years old. The researchers also utilized a stratified random sampling method to obtain the correct sample size for each of the 4 sections. Table 3 shows the students' perspective on gender preference for nursing care procedures according to hygiene and comfort, wherein it is evident that the respondents would prefer a female nurse, most likely to perform the following nursing procedures present in our questionnaire.
Table 4 shows the students' perspective on gender preferences in terms of physical assessment, wherein majority of the participants more likely prefer both a male and a female nurse for their provider of care.
In Table 5, in terms of meeting the needs of clients requiring surgery, the majority of the participants more likely prefer both a female and male nurse for their provider of care, except for the procedure of undressing the client in preparation for surgery, where it is evident that female nurses are preferred more than male nurses.
For Table 6, in terms of administering medications, more than 3/4 from the participants answered most and more likely to prefer a female nurse for the procedures.
Results in Table 7 show that majority of the participants prefer a female nurse for procedures under measuring urinary and bowel elimination. It is also evident that majority would least likely or not prefer to receive this type of care from a male nurse.
Next following slides will show the significant relationship between the students' gender preferences and the profile variables. For Table 8, there is a significant relationship between the participants' preference for nursing care and the profile variables of sex, of the relationship between students' gender preference for nursing care in terms of hygiene and comfort, wherein majority of the participants preferred a female nurse for their provider of care.
9 shows the physical assessment. The results indicates that the profile variables like sex, age, and section is not an indicator on the gender preference in terms of physical assessment, wherein majority of the participants preferred both a male and a female nurse for the provider of care.
Table 10, meeting the needs of clients requiring surgery. The results indicate that only sex is an indicator of the gender preference for nursing care in terms of meeting the needs of clients requiring surgery for both male and female nurses, wherein the majority of participants preferred a female nurse as their provider of care.
Table 11, it shows that there is moderately low positive significant relationship between the students' preference on both male and female gender, which also shows that sex is an indicator for gender preference.
For Table 12, results show that among the variables, only sex is an indicator on gender preference for nursing care in terms of measuring urinary and bowel elimination for both male and female, wherein majority preferred a female nurse for their provider of care.
The data indicates that most participants would prefer a female nurse in performing the procedures. Also, it showed that sex is an indicator on gender preference for nursing care, but not on age and section. The results indicate that sex is an indicator on the gender preference for nursing care in terms of hygiene and comfort, physical assessment, meeting the needs of clients requiring surgery, administering medications, and measures for urinary and bowel elimination.
So for the recommendation for hospital administrators to consider having an in-depth discussion on how to address and cope with gender preference, for the registered nurses to also explore their own culture and social norms to find out the expectations of the population, and to the clinical instructors to have better understanding of gender barriers. As this study is conducted amongst nursing students, their preference can change over time since they gain more exposure involved to become competent nurses, and for students to be aware and have a better understanding of the conflicts that arise in the healthcare setting. And lastly, for future researchers to consider increasing the number of participants in the study, include an equally diverse sample size, and explore the participants' attitudes that may influence his or her choice.
Study results will be published and book-bound to be passed to the University of St. La Salle College Library, passed in partial fulfillment for the nursing research subject, and the data will also be available to serve as a basis for future researches in relation to the research paper. Here are our references, and we would like to acknowledge the following people: Thank you and have a great day.